Good Monday morning to you. This is Mornings with Richard Cross on SuperTalk, Mississippi. Just a short time ago that we visited with this guest, but happy to do it again this morning. Just because I had a friend with the same last name as you, and people rarely pronounce his last name correctly. So I'm going to let you say it. Are we long O or short O?
It is a short O. It is Robertson.
That is the voice of Richard Robertson, President and CEO of the Mississippi Hospital Association. I just wanted to make sure I got that right. I think I just guessed last time and wanted to make sure I got it right.
Man, you nailed it. No, I appreciate you. As quick, funny story. My great grandfather dropped the T about 175 years ago because he was tired of his mail getting confused with some Robertsons somewhere outside Savannah, Tennessee, just north of Corinth and all that area.
Yeah.
And it fixed his problem for the last 30, 40 years of his life. But man, the official name change kind of messed the rest of us up. So
yeah, nobody would have said Robertson all of those years and mispronounced it. But
that's right.
All right. So we got the important stuff out of the way. You were in our nation's capital today, Richard. When we talked a couple of weeks ago, we talked about some of the concerns that exist for hospitals and in the healthcare industry, especially as it pertains to federal funding. Tell me what you're there for today.
So we're up here with the American Hospital Association's annual meeting where they have a lot of guest speakers come in and many people from Washington, D.C., from federal agencies, political commentators, or these days maybe political speculators, and trying to think through what's going to happen and politically. And then we also get a chance to meet with our great Mississippi delegation over the next couple of days, and just talk about things from back home, share things with them that are going on. They're important for Mississippi hospitals, and not just hospitals, but Mississippi healthcare. So this is the time of year we do that, and glad to be up here and get to visit with some good folks.
There is uncertainty that exists right now in terms of what funding models are going to look like going forward as it pertains to reimbursements for states with Medicare, Medicaid. So many questions to be answered, and we don't have a budget yet. I saw I guess it was a post from Mike Johnson, the Speaker of the House, this morning, talking about that big budget. Said it has 7 committees at this point have marked up the budget. There are 4 more to go. They've got a very aggressive timeline to try and get it done. I guess I say that to say it feels like there are a lot of cooks in the kitchen. Do you have a sense right now for ultimately what it is going to look like when it crosses the finish line?
I don't. We're getting more details, more speculation as to what it could look like as far as Medicare, Medicaid. The president, of course, has said that he doesn't have an intent to cut Medicare or Medicaid. Congress has some different ideas, it looks like, on that. What we heard yesterday was there's a lot of talk about trying to get this bill through by the 4th of July and trying to have the drafts and all those, I guess, committee work and all that stuff done so it's moving forward by Memorial Day. So that's a pretty aggressive timeline considering where we hear things are right now. So we'll see, but 4th of July is a date that was thrown out there yesterday by a few of the commentators that we heard from.
Well, and 4th of July sounds like a long way off. I mean, it feels like we were just starting the legislative session in Mississippi, but we're on the 5th of May. We're talking less than 2 months if they hit a 4th of July deadline. That's moving pretty quickly. Does that concern you that it goes from markup to potential final passage by the 4th of July?
Well, it concerns me that, we need to focus more on what's in the bill and not how quickly we get a bill out. And, that's our concern, is that because of the unintended consequences. And you just need time for people to weigh in because there are going to be a lot of moving parts in there. And when there's a lot of moving parts, you need to stop and work through it just to make sure you don't have an unintended consequence. One of the classic examples of moving quickly was the Affordable Care Act itself. It got rushed through in in the last couple of months because of some things that happened in the Senate. And there were some unintended consequences, things that were supposed to be buttoned up, didn't get buttoned up. And so, that's a classic example of what can happen in healthcare when you try to move quickly instead of just taking the time to get it right the first time.
Yeah, so many people have called the ACA Obamacare through the years. It is legislation that went into place and was beneficial for a lot, but has cost a lot of people a lot of money. With now, good grief, 10, 12, maybe close to 15 years of history to look at. Was the ACA the best thing or the worst thing or somewhere in between that ever happened to the healthcare system?
I think there's a lot of good things that happened, and in Mississippi, we have taken advantage of many of the good things that have happened. Not all the things are good. Not all the things are bad. There have been some good things like letting your kids stay on your health insurance to the age of 26, especially if they're going through college, going through grad school, maybe. They're not able to get employer covered insurance. But stuff like that has been good. Some of the things that, additional rules, regulations, maybe, I think we could argue probably aren't as good. Things that may have added more cost to the system than were originally intended. But it's like everything that comes out of DC or even things that come out of Jackson. There's going to usually be a little bit of things that are little mixed results on it. So, but I think the main thing right now is where we are in this world that we're in, particularly with healthcare coming out of COVID and all the uncertainty and just the gut wrenching impact of that. And we're finally getting our sea legs under us. And then you just worry a lot about what's about to happen. That folks may be going too fast, too quickly, and we just need to take time to assess that. And even heard a really interesting quote or really interesting thought yesterday about tariffs even impacting some of the cost of healthcare. And over $74 billion are imported that relate to medical supplies and medical equipment, medical devices. And additional tariffs on that add additional costs. So if you're talking about 10, 20, 30% on top of $74 billion, all that cost has to get passed through somehow to someone. And, again, those are just things that, as people are picking that up and recognizing it, we're able to communicate that to our legislative delegations, to our congressional delegations, so that they can just be aware and we don't step off into some unintended consequences. So,
does that number include pharmaceuticals, or is that just equipment and supplies?
That's just equipment and supplies, but those are things that are just everyday things like needles, syringes, IV bags, those types of things that are needed every day in hospitals. But they're made overseas because it's less expensive. So they're less expensive things, but the total cumulative value of that adds up. So we just have to be aware of all those things.
Anytime you have a large government entity, we know that there's money that's wasted. I'm curious what your perspective is on DOGE, the Department of Government Efficiency, as they're looking at different programs across the board. Do you see that as a benefit to maybe strip out some of the waste within Medicare, Medicaid, the healthcare system, or are you concerned that they are just like going in with a chainsaw and cutting stuff and the results be damned?
Well, I'll say this: we are 100% supportive of eliminating fraud and abuse from the healthcare system. When I was with the state, with the Attorney General's office, and with the Division of Medicaid under Governor Barber, we spent a lot of time trying to weed out fraudsters and abusers of the system, and we were very successful with that. Our error rate measurements were typically the lowest or among the top 5 lowest in the country, which meant we were more accurate in what we paid for and who we paid than other states were. So we did a great job on that, and I think our agency still does a good job on that as far as what we paid through Medicaid. There's always a ton of fat to trim in any large program, whether it's state, federal, or even local. There's always some fat that can be trimmed here and there, but sometimes that fat's in the eye of the beholder. And one person's view of something may be very different than another person's view, and critical funding for research and the things that we benefit from and learning how to treat diseases, that's important funding. And so we do want to make sure that we let folks know about the impact of those decisions, and then they can make up their own mind. We elect them, we send them here to make decisions on our behalf, but I see our role as making sure that we've informed them.
If you happen to bump into Drew Snyder today, tell him that I said hello. He and I were in school together. So proud of him and all of his success and all the good work that he's doing. But pretty cool stuff there.
I will tell him hello for you. So
sounds
very
great.
good.
Richard, thanks for checking in this morning. Here's to fruitful meetings, and hopefully you learn some stuff that you can share with us when you get back home.
We'll do it. Thanks, Richard. I appreciate you.
You as well. Richard Robertson, President, CEO of the Mississippi Hospital Association, joining us on Mornings with Richard Cross. We'll stick with a guest when we come back. Patrick Sullivan is next.